6 signs your blood is not flowing properly after 50. Don't ignore this. Hello and welcome. If you're over 50, or if you love someone who is, this video could genuinely make a difference in your health or theirs. Your blood is essentially your body's delivery system. It carries oxygen and nutrients to every organ, every muscle, every cell, and carries waste products away. When that system starts to slow down or get blocked, everything suffers. Poor circulation is one of the most underdiagnosed conditions in adults over 50. It doesn't always show up dramatically. It creeps in slowly, and that's exactly what makes it dangerous. Now, before we begin, I want to be clear. I'm not here to scare you. I'm here to educate you so you can have an informed conversation with your doctor and take action early, when it matters most. Let's get into it. Sign number 1. Cold hands and feet, even indoors. The first sign is one that millions of Americans over 50 experience, and almost always chalk up to just being cold. Persistently cold hands and feet, even when you're indoors and the temperature is comfortable, is one of the earliest warning signs of poor circulation. Here's why this happens. When blood flow becomes restricted, whether due to narrowing arteries, plaque buildup, or a condition called peripheral artery disease, your body prioritizes blood flow to your vital organs first. The heart, lungs, and brain. Your hands and feet. They're last on the list. So when circulation is compromised, the extremities are the first to feel it, literally. Animation note: show blood flowing from heart outward, tapering off at hands and feet. Now, occasional cold hands on a winter morning? Completely normal. But if your hands and feet are consistently cold, even in summer, even under blankets, that's your body waving a flag. Other things to watch for alongside cold extremities. A bluish or purplish tint to the fingers or toes. Numbness that comes and goes without explanation. One hand or foot noticeably colder than the other. That last one, asymmetry, is especially important. If one limb is dramatically colder than the other, that can signal a blockage in a specific artery and warrants immediate medical attention. What to do? Mention this to your doctor. They can order a simple ankle brachial index test, which measures blood pressure in your legs versus your arms to check for arterial blockages. Sign number 2. Swollen legs, ankles, or feet. Sign number 2 is one of the most visible and most ignored signs of poor circulation after 50. Swelling in the lower legs, ankles, and feet, medically called edema, occurs when blood isn't circulating efficiently back up toward the heart. Think of it this way. Your heart pumps blood down to your feet with relative ease. Gravity helps. But getting that blood back up requires strong vein walls, healthy valves, and good muscle function. When any of those break down, blood pools in the lower limbs. Fluid leaks out of the blood vessels into surrounding tissue. And you get swelling. After 50, the small valves inside your veins, the ones designed to prevent blood from flowing backward, can weaken. This is called chronic venous insufficiency, and it affects an estimated 40% of Americans at some point in their lives. Signs that the swelling may be circulation-related. Swelling that's worse at the end of the day and better in the morning after lying down. A feeling of heaviness or itchiness in the legs. Skin around the ankles that looks tight, shiny, or discolored, sometimes a brownish-red hue. Pitting edema, when you press your finger into the swelling and it leaves an indentation for several seconds. Now here's an important warning. Sudden, one-sided swelling in the leg, particularly if accompanied by warmth, redness, or pain, can be a sign of deep vein thrombosis, commonly called a DVT, which is a blood clot. That is a medical emergency. Do not wait. Go to the ER or call 911. What to do? Elevate your legs when resting. Walk regularly to help pump blood back to the heart. Compression stockings can help. And always, have unexplained swelling evaluated by a physician. Sign number 3. Varicose veins and visible vein change. Sign number 3 is one that many people see as cosmetic, a vanity issue. But varicose veins are far more than a visual concern. Varicose veins are swollen, twisted veins that you can see just under the surface of the skin. They happen when the valves inside the vein stop working correctly, allowing blood to flow backward and pool. The vein stretches, bulges, and becomes visible. They most commonly appear on the legs and feet, exactly because those areas fight gravity the hardest. But here's what most people don't know. Varicose veins are a symptom of an underlying circulatory problem, not just a skin issue. They indicate that blood is not moving efficiently through the venous system. Beyond the visible bulging veins, watch for these related warning signs. Spider veins, smaller, web-like networks of red or blue veins visible on the skin. Skin around the ankle that becomes brown, leathery, or hardened. This is called lipodermatosclerosis, and it signals serious chronic venous insufficiency. Open sores or venous ulcers near the ankles that are slow to heal. This is a late-stage sign that requires prompt medical care. After 50, the risk of varicose veins increases significantly. Factors like prolonged standing, obesity, pregnancy history, and family history all play a role. But age itself causes vein walls to lose elasticity. What to do? Don't dismiss varicose veins as cosmetic. See a vascular specialist. They can assess the severity and recommend treatments ranging from compression therapy to minimally invasive procedures like sclerotherapy or laser treatment. Sign number 4. Fatigue, brain fog, and difficulty concentrating. Sign number 4 surprises many people, because most of us associate poor circulation with physical symptoms. But your brain needs blood just as much as your legs do. Unexplained fatigue, mental fog, difficulty concentrating, and memory lapses can all be signs that your brain and body aren't receiving adequate blood flow. When circulation is compromised, oxygen delivery suffers. Your muscles feel sluggish. Your brain, which consumes about 20% of your body's total blood supply, becomes starved for the fuel it needs to function at full capacity. The result? You feel mentally slower. Tasks that used to be easy become harder. You forget things more frequently. You feel tired even after a full night of sleep. Now, fatigue and brain fog have many possible causes. Thyroid issues, sleep apnea, depression, anemia, and many medications can all cause these symptoms. That's exactly why it's important to get evaluated rather than assume. But here's the critical point. If your fatigue and cognitive sluggishness come alongside any of the other signs in this video, the likelihood of a circulation component increases significantly. There's also a more serious concern here. Chronic reduced blood flow to the brain is a risk factor for vascular dementia, the second most common form of dementia after Alzheimer's. Protecting your circulation is literally protecting your brain. What to do? If you're experiencing persistent fatigue and cognitive changes, don't just accept them as aging. Talk to your doctor. Blood tests, a complete cardiovascular workup, and even brain imaging can help identify circulatory contributors. Sign number 5. Slow healing wounds and sores. This is the sign we mentioned earlier that surprises almost everyone, and it may be the most medically serious one on this list. If cuts, scrapes, or sores on your legs or feet are taking much longer than usual to heal, or aren't healing at all, this is a major red flag for poor circulation. Here's the biology behind it. Healing is a process that depends entirely on blood flow. When you get a wound, your body rushes white blood cells to fight infection, platelets to clot the blood, and growth factors to rebuild tissue. All of that is delivered by your bloodstream. When circulation is compromised, that delivery slows dramatically. Wounds become chronic. They get infected more easily. And in serious cases, particularly in people with diabetes or peripheral artery disease, they can develop into non-healing ulcers that may eventually require amputation if not treated aggressively. This is not a hypothetical risk. In the United States, over 150,000 amputations are performed annually, and the vast majority are directly related to poor circulation and diabetic complications. Warning signs to watch for. A wound or sore that hasn't improved after 2 weeks. A wound that appears dark, dry, or has a dark border. No sensation of pain around the wound, which itself indicates nerve damage from poor circulation. Sores that repeatedly open and close in the same location. What to do? Never ignore a non-healing wound. See your doctor or a wound care specialist immediately. Time matters enormously with circulatory wounds. Sign number 6. Cramping, aching, and leg pain when walking. Sign number 6 is one that many people misattribute to arthritis, joint pain, or simply being out of shape. But there's a very specific pattern here that points directly to circulation. If you experience cramping, aching, or pain in your calves, thighs, or buttocks that comes on during walking and goes away with rest, this is called claudication, and it is a hallmark sign of peripheral artery disease. Peripheral artery disease, or PAD, occurs when the arteries supplying blood to the legs become narrowed by a buildup of fatty deposits, the same process that causes heart attacks and strokes. In fact, people with PAD have 3 to 6 times the risk of heart attack or stroke compared to people without it. The reason claudication happens with walking is simple. When you exercise, your muscles demand more blood. Healthy arteries expand to meet that demand. Narrowed arteries cannot. So the muscles literally run out of oxygen, and they cramp and ache as a result. When you stop and rest, the demand drops, the pain fades. Over time, if PAD worsens, the pain can occur even at rest. Severe PAD can cause critical limb ischemia, a condition where tissues begin to die from lack of blood. This is a true emergency. Also watch for hair loss on the legs or feet, shiny, tight-looking skin on the lower legs, toenails that grow slowly or thickly, feet that are pale when elevated and turn deep red when dangling down. What to do? Tell your doctor about any leg pain with activity. An ankle brachial index test is quick, painless, and can diagnose PAD in minutes. Early treatment, which may include lifestyle changes, medications, or procedures, can make an enormous difference. What you can do: lifestyle tips to support circulation. Now, here's the good news. Your circulatory system is remarkably responsive to lifestyle changes. You are not powerless here. Let's talk about what actually works. Number 1. Move every single day. Walking is one of the most powerful things you can do for your circulation. Even 20 to 30 minutes of brisk walking daily helps keep your veins pumping and your arteries flexible. If walking is painful, talk to your doctor. Even gentle movement in a pool or chair-based exercise counts. Number 2. Stay hydrated. Blood is roughly 90% water. When you're dehydrated, blood becomes thicker and flows more sluggishly. Aim for at least 6 to 8 glasses of water daily. More if you're in a hot climate or physically active. Number 3. Eat for your arteries. A diet rich in omega-3 fatty acids, found in salmon, sardines, walnuts, and flaxseed, helps reduce arterial inflammation. Colorful fruits and vegetables are packed with antioxidants that protect your blood vessel walls. Minimize processed foods, trans fats, and excess sodium, which raise blood pressure and damage artery linings. Number 4. Quit smoking, if you haven't already. Smoking is one of the single most destructive things you can do to your circulation. Nicotine causes arteries to constrict and accelerates arterial disease dramatically. It is never too late to quit, and the benefits begin within hours of stopping. Number 5. Manage your chronic conditions. Diabetes, high blood pressure, and high cholesterol are the 3 biggest drivers of circulatory disease after 50. If you have any of these, work with your healthcare team to keep them well controlled. This is non-negotiable. Number 6. Don't sit for long periods. Prolonged sitting slows venous return dramatically. If you have a desk job or watch a lot of television, make a habit of standing or walking for at least 5 minutes every hour. Simple ankle circles and calf raises while seated also help. Let's do a quick recap of the 6 signs your blood may not be flowing properly after 50. 1. Persistently cold hands and feet. 2. Swollen ankles, legs, or feet. 3. Varicose veins or visible skin changes on the legs. 4. Unexplained fatigue and brain fog. 5. Wounds or sores that are slow to heal. 6. Leg cramping or pain when walking that goes away with rest. If you recognized yourself in any of these signs, please don't wait. Schedule an appointment with your doctor and specifically mention what you noticed. Don't assume it's just aging. Don't hope it goes away on its own. Early detection of circulatory problems can prevent heart attacks, strokes, amputations, and cognitive decline. Your circulatory system has been working for you every second of your life. It deserves your attention. If this video was helpful to you, please give it a thumbs up. It helps more people find this information who need it. And subscribe if you want to keep getting clear, honest health information made specifically for adults over 50. Take care of yourself. You've got a lot of living left to do.